So are we riding the Omicron roller coaster? Hi folks, here at Cobb and Douglas Public Health, we're going to go inside to talk to Dr. Janet Memark, the director here, about the Omicron and COVID in Cobb County and the charts that now look like the stock market.
Glad you noticed that. So we're still at very high caseloads. We're at 1,754 cases per 100,000. So that's over 2 weeks. Remember, 100 is that number we want to stay below. So I'm surprised myself. I thought that we would be down much further than where we're at right now, but still in exceptionally high ranges. And it looks like through the state and in the in Metro, we've come down some, probably about 50%, and we've kind of plateaued at a very high level right now. And it may be that, we have people back in circulation, and maybe that's what's causing some of this, or just, it just keeps going and infecting folks. But we hope we continue to go down on that, but we're hearing that other areas of state are seeing increases now, and so it seems to be kind of spreading out throughout. Our positivity rates still remain high, so a quarter of people that are being tested in those PCRs are coming back positive, so about 24%. So that's still very, very high. Remember, we want that below 5%. So this probably has to do a lot with just how infectious this Omicron is. When we're looking at hospitalizations, the same thing. We've gotten a little bump this week as well. It was coming down, it was a nice trend, and then this week had a little bit of a bump up. And so we're watching that. It seems to be the main hospital, but the other two have plateaued a little bit. But when you look at the Georgia Coordinating Center, there's still a severe capacity right now, so very, very, very busy.
So a lot of people have been saying that this Omicron variant isn't as bad on you, but yet we see this effect on the hospitals. Those people in the hospitals, who are they and what's happening to them?
So when we're looking at the cases in the hospitals, we have almost 300 cases of Omicron in our area hospitals right now. And so some people say, oh, well, those people come in with other things and have Omicron, right? But when we check with the hospital, there's a lot of people that have actual respiratory symptoms of Omicron, and that's why they're admitted to the hospitals. And so you will see some people that have, coincidentally, but we continue to see a lot of people in the hospitals that have Omicron and are being treated. So remember, we had talked about this before. When you infect this many people this fast, even a small percentage of folks in the hospital are going to overwhelm the hospital systems. And, kudos to them that they have done well and hanging on, but this is the 5th surge that they're going through, and staff are exceptionally tired and really burnt out. And so they're really keeping up, but I'm sure they need a little bit of a break from this.
And I'm an example of this, where I need to go see a doctor about a specific thing, but I've been delayed twice already because of COVID. And that's the concern I think our chairwoman has, is that the effect, not just on the fact that hospitals are full, but just the healthcare system in general.
Absolutely, and that's the downstream effects of it too, right? Even if you have elective, surgeries, some of it is not that elective, right? If you have a gallbladder that's hurting you, or you have to have something done cardiac, you need to have it done, right? And so, some of those things are being delayed, but I'm glad you bring that up. If you have certain conditions or diseases that need to be managed, like diabetes and hypertension, please make sure you have those taken care of. Even if you don't go in physically to the hospital, they can do some telehealth stuff with you and help you get a lot of that under control. You do not want to let that go. If you talk to the doctors that are working in the hospitals, they will tell you they have seen people that have not been managing their chronic diseases and come in with, and not get your prevention as well, and come in with later stage cancers, with issues related to hypertension and things like that. So please make sure you take care of that with your providers.
Just for the record, my condition's not that serious, but my appointment's been delayed twice because the doctor's office has tested positive for COVID. So that's the problem with that. I don't want to be the bearer of bad news or doom, but we keep hearing on the news about Omicron's evil twin or something like that. What can you say about that?
Yeah, unfortunately, we are hearing about another variant of Omicron. And so this one's called BA2. So BA1 was Omicron, now we have BA2. It is making its way through several countries right now, and some countries that had been hit with Omicron as well. And so that's a little bit concerning for us. But what we are hearing, though, is the vaccines are still holding up. And so if you have you gotten your 2 or 1 dose series and you get your your booster. Your booster is very important. That is what's going to bring up your immunity level. So make sure everybody is eligible 12 and over for a booster, so you make sure you get that done. And that will help you against severe illness and hospitalization as well as death. So very, very important. As all these variants come through, it's important to make sure you got that immunity. And it's seeming like it's, maybe not going to be as serious, but once again, very infectious, so we have to make sure we cover ourselves.
So one thing I've noticed recently is driving by these testing sites is that the lines are pretty much gone for them, for the most part. Why do you think that is? And also there's still that confusion out there about these self-tests versus the PCR tests.
So what we have noticed is when we have something going on in the community, that's when we start hearing on our doors and your doors that we need testing, we need testing, we need testing, right? Lines wrapped around. But when things start getting a little bit better, testing seems to get a little bit better as well. And so that's what we're seeing, but we're keeping all those testing sites going because we have to make sure we're prepared. But another great question is, there's also a lot of testing that's available now as well, right? And so a lot of you were able to go pick up some tests from Jim Miller Park that Cobb County government gave out. But you can also go and get other tests. So you can go to covidtests, plural.gov, and get your 4 free antigen tests sent to your house as well. And so you can have those done, and you can get 8 per month through your insurance and through other providers as well. And so the difference with that is you have to pay $12 a month, or no, $12 per test, and Medicare and Medicaid doesn't cover those tests. So you might be asking yourself, when should I take an antigen test? When should I take the PCR test over at Jim Miller Park or East Cobb or something like that? So basically, if you have to have the gold standard definitive test, then the PCR test is the way to go. That test, the one that you have at the parks that are being done, that is the best test that's going to pick up on any virus that you may have. Now, the downside of that test is if you have had it, and you might have had it a while ago, you might not be infectious at that time. If you have symptoms and then your tests come back positive, then that's what you got, COVID, right? Now, if you're non-infectious and you wanted to go somewhere and you got that PCR test, that's a little bit different, right? Maybe you had it previously. So that's the thing with that test, super, super sensitive. Now, the home tests are a little bit different. They are not as sensitive. Now, they still have high sensitivity, but they're not as sensitive as the gold standard test. And so when you get those done, if you get a positive, then, it's a pretty good chance that that's what you got. You got COVID, you tested positive for it. Now, when you get into the negatives, that's when it gets a little bit murky, okay? If you get a negative test and you are full-blown with symptoms and your loved one was diagnosed with COVID recently, or you were a close contact, I would look at that test twice, right? If you sound just like the person next to you and your test came back negative, then you probably need to go get a PCR and double check that. We have seen on multiple occasions that it's related to your viral load. So if your viral load needs time to come up for that test to come back positive, then it's not going to come back positive at that moment. Now, you can continue to isolate and get that test done like every 3 days, and then you have a better chance of picking up what's happening over there. But if you need a definitive test, you go get that PCR test. So when it's positive, it means a lot more. When it's negative, you really got to stop and think to yourself, okay, is this what's going on right now?
There's been this ongoing conversation out there that this is just something we're just going to have to live with going forward. Do you think that's the case?
Yeah, I think we are going to eventually have to live with it going forward. And, it's going to be like, influenza was. You go through the 1918 flu. I do think that's where we're going to head. I think vaccines are going to be really important on this. And so, we may get to the point where, it's like influenza. So the vaccine coverage matches that mutant for that year, then we're good. And there may be years where, it's not as good a coverage. And so, but I pray that we continue to see what we're seeing even in influenza, that if you get your flu shot, maybe it's not the exact same, flu, that strain that's there, but you're still protected against hospitalization and death. So I don't know if you see a pattern here, but I'm going to make sure I'm going to get my shots because I don't want to take the chance. So
again, we keep hearing about cases in schools. it just seems again like this has become the norm.
Yeah, and so, I get a lot of questions about what I should do. Like the parents are confused about, now we have schools that are not doing contact tracing anymore. And so what do these letters mean? What do how do I protect my children? Things like that. And, the best thing I can tell you, honestly, is, do what you can to protect yourself and your children. And that's the best that you can do. I send my children masked up to school. Okay, so that we can protect others and also have some protection for themselves. My children are vaccinated, so get them vaccinated, and 12 and over, get their boosters. 5 and over, get them vaccinated. So that's going to protect your kids and also get your family vaccinated and boosted as well. It is always possible that they can bring it home, but if you have your loved ones protected, then you're going to be in the best possible spot. We only have a quarter of our residents that are boosted, and so we need to have a lot more. If we're going to go against Omicron, baby Omicron, whatever is next, then we all need to be protected as we move forward, because we are seeing a lot of reinfections. When you said before to yourself, oh, I was protected because I got Delta, that is not happening. We are seeing people reinfected time and time and again. So please make sure that you get your immunity boosters.